Everyone, Dr. Remy from Pain Free and Fit. Today, a great video for those of you with spondylolisthesis and acute disc herniation and bulging pain, a nice pain relief exercise that you may find valuable. Hope you enjoy. So if you've seen any of the other videos on the channel over the last several years, you know I'm always emphasizing the point that exercise needs to be tailored for an individual. Whether you've been diagnosed with spondylolisthesis, disc herniation, stenosis, you need a exercise that is tailored for your unique body mechanics, your muscle imbalances, your stability issues, your posture and movement tendencies, because someone with a spondylolisthesis with a disc herniation at L5S1 may need an entirely different exercise program than someone with the same exact diagnosis, because one person moves differently. One person has developed their muscles differently. Their stability muscles may be stronger, let's say, with an internal oblique muscle on one side, or weaker with a multifidus muscle. So you need an exercise program that's going to develop your unique ability to put your spine in a stable or neutral position and avoid aggravation. With that in mind, we're going to be talking today about a counterintuitive type of situation for spondylolisthesis. Those people with acute disc herniations and bulges. Most of the time in spondylo, most people need to actually decrease the arch in their back. Remember, when that spondylolisthesis vertebra has moved forward, the arch in your back, typically by increasing, is going to help to drive that spondylolisthesis even more forward. It's going to overstretch the ligaments that are already stretched and they're pain sensitive. It's going to compress the back of the disc where the facet joints and the posterior disc bulges or herniations or degeneration is, which can cause pain. And it even shortens the muscles on the back of the spine, which can develop trigger points and cause pain. But if you have an acute disc herniation or bulge where the center of that disc, the jelly in the middle, the nucleus, has moved backwards through tears or cracks in the disc and is bulging or herniating into an extension of the disc that goes backwards, when you decrease the arch of the back, you actually increase the compression on the front of the vertebra, and that drives more of that fluid backwards. It's similar to a balloon filled with water. If you squeeze one end, meaning if we tail under and crunch to open up the back of the spine, it puts more pressure on the front of the disc, which causes that fluid on the front of the balloon to push the water backwards. So we want to actually decrease that by using the opposite method. In this unique case of people that are having acute, meaning it's just happened, it's really severe back pain due to disc herniation that's moved backwards, or bulges where the fluid is moved backwards, we want to compress the back of the spine. Again, going back to that water balloon, if we push the back of the balloon together, it's going to help to squeeze that fluid forward, or squeeze that disc jelly or nuclear material back towards the center of the disc, thus relieving the pressure on the back of the disc. Remember, the back of the disc fibers are pain sensitive, not the inside of the disc, but the outside fibers where that fluid is pushing against that back or posterior wall, causing pain. So how do we do this? Because if we extend too much, of course, that's going to drive the spondylolisthesis more forward. It's going to stretch things, which also may be painful. So we need to approach this in a very subtle way where we create a slight extension, but not enough to aggravate pain. We discussed this in our last video using a traction or decompression technique, but today we're going to be talking about a very passive move, if you even want to call it an exercise. It's more of a healing maneuver where we use a roll, 4 to 6 inch diameter rolled up towel, for instance, and in the prone or laying face down position, we're going to place that roll right on the front of our hip bones. Now, on the front of your hips, there's only 2 points that are hard or bony, around belt level. You can't miss them. If you just go up the front of your thighs and lower abdomen and dig in right around the crease of where your leg meets your abdomen, just above that crease or just below where you wear your belt, you're going to feel these ASIS bones. That's the front of your pelvis. So we're going to take a close-up view in a moment, and we're going to show you how to position yourself in that way, and we're going to hold that for 5 to 15 minutes, which creates a slight extension, because as it moves the body upwards, it creates a slight extension from the pelvis moving backwards, but not enough extension to cause pain. Remember, the prone position, when you're laying face down, your lower back is going to arch. That's why many people with spondylo, if they lay on their stomachs too long, they'll feel pain. But with that roll underneath, it creates a slight extension with a slight tail under flexion, because as we push the pelvis from the front backwards, it creates a slight posterior pelvic tilting. helps to open up the back of the spine and creates just enough of net extension between those two forces of backwards traveling pelvis and backwards tilting to create a little extension and help that disc fluid move forward. So let's take a close-up view on that and see what it looks like. So I've located my ASIS bones, those hard bones in the front of my pelvis, just above my crease in my groin where my leg meets my abdomen, or just below my belt. And I'm going to get into this position and relax with my head down, my whole body nice and passively relaxed. I want to try to get into a position where it feels the most comfortable. So I may need to push that roll a millimeter or two down from that position, or a millimeter or two up from that position. That feels really nice in my low back. I really don't feel anything. I don't feel any pulling, any pressure, any pain. And then I'm just going to relax there for 5 to 15 minutes, motionless, and let the disc fluid move from its posterior or backwards position towards the center of the disc. So you'd remain in this position for 5 to 15 minutes. Again, you may have to move that roll slightly up or slightly down. If you have a problem where you, let's say, hip hike on one side, you may want to create a correction where you push that leg a little longer in that position. If you have a problem, let's say, where you rotate more to one way, you may want to set yourself up with some pillows in that position. I'm creating a little counter rotation, putting myself back to neutral. The idea is you want to try to be in as perfect alignment that's comfortable for you and remain there for 5 to 15 minutes. When you get up, you try to hold the same amount of arch that was created in the back in that position slowly, and many times this will help to relieve pain. I invite you to subscribe to our channel. Got a lot of great other videos out there to help with spondylolisthesis pain. Questions or comments, you can write in as always, and I'll do my best to answer. And remember, if you're looking for a great program to figure out what exercises are right for you, how to develop a routine to stabilize your spine, get back into shape without hurting yourself, check out our fast track program for spondylolisthesis, available at painfreeandfit.com. And as always, if you're having difficulty with your analysis of your body or putting together an exercise program, I'm always available on Zoom for online consultations. That information is also available at painfreeandfit.com. I hope you enjoyed this exercise of a passive hold with a roll under your ASIS bones to help relieve disc pressure due to herniations and bulges associated with spondylolisthesis pain.